Okay, well, Dr. Eichold, I've got 5:31, and I don't want to keep you. Let me first, on behalf of the Temple Board, tell you how appreciative we all are for you in your role as the Mobile County Health Officer and your expertise on COVID, but particularly taking the time tonight to give us a few minutes of your expertise to brief us on COVID. I thought what we would do, if it's okay with you, knowing that we won't take up too much of your time, but we would ask you for a short overview on where we are with COVID. And then some of these nice Temple members, many of whom you know, may have some questions for you. And I also wanted to, now that it's 5:30, also thank my wife, Amy Walsh, who's on the call with us, for helping me set this up. And I also wanted to just very briefly introduce you. I got some of this information from our Temple historian, so please correct me if any of this is incorrect, but you and your family are, of course, have a tremendous influential history with the Temple. Our Temple library, where many of us serve on the board and used to appear before COVID on a monthly basis, would view, I believe that was your great-grandfather. The Eichold Library is named for your great-grandfather, isn't that correct?
That's correct.
So, and I know that he served on the Temple board. I believe that your grandfather was the president of the Temple. And I know that your father, I've heard lots of stories about your dad. He was quite influential in the setup and funding of the Temple archives. And I know my grandfather was involved in that well, and your father was very selfless and generous with his money and helping to fund publications for the Temple and the archives and otherwise. So you are a friend of the Temple. You are always welcome at the Temple. I wish you would come see us at the Temple. And on behalf again of the board and our president, Gil Layden, who's on this call, thank you so much for your time.
Well, my pleasure, and thank you all so much. Eichold family had many experiences at the Temple, and my grandmother, Miss Myra, was very probably the last really active member at the Spring Hill Avenue Temple.
Thank you, Doctor. Before we get started, maybe because I've been on so many Zoom calls like you, if after Dr. Eichold speaks, if you have a question, raise your hand or say your question. But right now, when the doctor is speaking, if you would, please mute your audio, and Doctor will turn over the floor to you for a quick update on where we are with COVID.
All right. Well, please just y'all call me Bert. It's an interesting timeline. I think as we go forward, thank you, number one, for your interest. Number two, thank you all for being safe and taking this seriously. It's a serious illness that is negatively impacting our community and it's really changed the way we do business. But just on a timeline is this all started in December of 2019 in China. The USA index case was January the 19th. As we move a little bit forward, which most people don't realize, the January 31st, the Secretary of Health and Human Services, so again, January 31st, declared a public health emergency. And then February 11th, WHO made comments. And then we had the first US death, February the 29th. So if you think from when Secretary Azar, January 31st, declares a public health emergency to the first death at the end of February, that was an entire month that we basically did not do very much in the United States. Alabama first case was on March the 13th. President Trump declared a national emergency beginning March the 1st. He backdated it from March the 13th. And then we have moved forward. So now at this point in time, it's been 205 days since we had our first case in Mobile County, Alabama. The mortality rate for this is running at about 1.5 deaths per day for Mobile County and 4 deaths per day for the state of Alabama. Things are getting better right now. So in Mobile, we had had 10 new cases of COVID in the last 24 hours. Our total death count is 309, but that number went up 7 in the past 24 hours in Mobile. The percent positive of cases, which is how we index whether this is community transmission, is right now we're running about 5% of the PCR, which is the molecular test that they go in your nose and test for COVID-19. About 5 to 7% are positive in the state, depends on what county you're in. In Mobile, we're running about 9 or 10% positive for PCR testing. Our high point has been 22% of the people tested were positive for COVID-19. So that's good news. We have to attribute the change to finally people wearing masks. And it is really making a difference. Our governor has held firm on wearing masks. I got a call right at 5 o'clock this afternoon as I was leaving the office. Basically, someone complaining about department stores, retails that are not requiring people to wear masks. So we'll have our public health individuals go by and help educate that there is a requirement to be wearing masks while doing retail sales. The grocery stores and community have really done well for those as far as senior citizens, which, you know, I think Michael may be the youngest and they may be the youngest ones on the call, like Publix and Fresh Food are actually Fresh Market doing a great job cleaning their retail stores. And so the people who have underlying disease shop first thing in the morning and wear masks, and they're all requiring people to have their face covered. So as we move forward, we talk about vaccines. That is going to happen. I personally do not want it to happen too soon, because if we do not get it right, if we start having adverse reactions from the vaccine, unfortunately, everybody's going to run and nobody's going to want to take it. So we got one opportunity to get the vaccine program right. So as we're planning to move that forward, we will have to have IM injections. Some will have to have 2 injections. And some will get by, we think, with 1 injection. The challenge that we have about vaccines is Pfizer's product, which is coming to market, has to be stored at minus 80 degrees centigrade. So if you think about storing a large quantity of vaccine, that in itself is a challenge. We're working closely with our hospitals and other facilities about how much storage capacity we have at that temperature. Bert's philosophy is if we are prepared to receive the minus 80 degree vaccine, there's a high probability that we will receive a larger quantity than other geographic areas because of the lack of storage in order to preserve the medication. So it's going to be a challenge. The private doctors are probably not going to use the Pfizer product just because of the refrigeration requirements. The other 2 products are probably stored at minus 4 degrees centigrade, which is routine storage temperature for vaccines. There's talk about getting your vaccine at a fire station and getting your vaccine in different places. We're actually practicing drive-through flu clinics again. We've been doing this for years, so y'all can remember that Mobile County Health Department was the first in the state to do drive-through flu injections, and that was for the sole purpose of training our staff in order to be prepared to immunize people during such a situation. So we are going to continue with the drive-through flu clinic. We anticipate having drive-through COVID-19 clinics. The sites, we're working on those different locations, but it should be a challenge, and we think it's going to be a Alabama National Guard, Alabama Department of Public Health joint venture in order to protect the people of the state. The number of people we need to immunize is a herd immunity is about 60%. Some places say up as high as 70 or 80%. But in general, that's a lot of people. So in Mobile County, we have 400,000 people. If we have to give one injection, then you're talking about 250,000 injections in order to get herd immunity. If we have to give 2 injections 30 days apart, then that's going to be a much larger challenge for us as a community. How people will respond, we're getting ready to go forward with a survey of people who would want to take the vaccine. It's been nationally estimated that 35% of the population would take the vaccine if it were available right now. So that's going to be the challenge. If we don't get people well vaccinated, we're going to have to deal with COVID-19 for a long time, because then it'll be basically we'll have to do sentinel surveillance for COVID-19, which we'll just have to watch communities. If we see COVID-19 outbreaks in 5 years from now, then we'll have to start vaccinating aggressively the people who are the contacts and isolate. We've heard on the national news that there are 150 million spot tests coming out. That is good. We need to do more testing so we know who's infected and people can then quarantine. But 150 million is an extremely small number of vaccines. So there are around 60 million people in public schools. So if we just test everybody now and then want to test them in a month, we'll pretty much use up that supply of test material. So the challenge we have in public health is we have point of care testing, which most of y'all are familiar with. You go to a urgent care and they can do a COVID-19 test. That's an antigen test. It's a point of care. Those tests are not automated and electronically reporting to the Alabama Department of Public Health. So we're having to manually collect that data from those facilities on how many test positive, how many test negative. So that's kind of where we are with COVID-19. It's a challenging time. It's going to be with us probably for more than a year. Everybody asks the question, when's it going to go away? It has not gone away in cooler weather that we had in February, March, and April when we had large numbers, large community transmission rates. It has not gone away during the heat of the summer, and now as we approach the fall of the year, I anticipate COVID-19 will be around year-round with us. It started again in December, so we're almost moving towards a year of COVID-19 in the United States, and no real end in sight as far as transmission. The good news is we've learned a tremendous amount about COVID-19. We know better how to treat it. We know better about how to prevent it. There were concerns about wearing masks early on. We did not think that COVID-19 could be transmitted asymptomatically. So when we first started dealing with COVID-19, we thought you had to have fever, chills, cough, symptoms in order to transmit the virus. That's why masking was not started until later on during the course of the epidemic, when we found out that 20% of the people infected may be asymptomatic, and they're able to spread the virus to other individuals. The incubation period for COVID-19 is about 5.1 days, American Journal of Medicine article, up to about 13 days. So when you're told that you're a close contact and you need to quarantine for 14 days, that is founded in science. You cannot test out of quarantine. So if you had a friend who tested positive, that you had more than 15 minutes, cumulative minutes, it's less than 6 feet apart, then you're considered a close contact and you need to quarantine for 14 days from the time that that individual tested positive or 2 days prior to them becoming symptomatic. And if you you yourself test positive, you need to quarantine for 10 days. And a lot of people say, oh, well, my best friend tested positive and I've had 2 tests and I'm negative. No, if you spent the time, you need to go ahead and quarantine. And the time that the quarantine ends is from the 10 days from the end of symptoms. So if you test positive, then you have symptoms for 4 days, then it's 10 days from the time that you had your last symptoms. So I'll be glad to answer questions. It's a challenging time, but what it really shows right now is how fragile we really are in the environment we live in. And this is completely unknown and new to us. And the vaccine we're developing is the first RNA, ribonucleic acid vaccine that we've ever developed. So this is all new stuff. And, you know, this will be a challenge, but I'm very optimistic that we will have a good outcome and we will get through this. We just all have to be cautious. So Michael, if questions?
Anyone?
Yeah, I have a question. Bert, if you've tested positive for COVID-19, you've had the symptoms, you've been quarantined, you go back to work, supposedly you'll have antibodies to the COVID. Do those individuals, how long do the antibodies last, and do those individuals need to be vaccinated?
Yeah, a very interesting question. We know that people have developed, we measured antibodies in people, and the antibodies seem to appear as the more severe the illness, the longer you have antibodies. We measured them up to 120 days, 90 to 120 days with people who are very symptomatic. People who had asymptomatic disease don't appear to have antibodies after about 60 to 90 days. Or the antibodies seem titers, the level of antibodies seem to be waning. What we don't know is about cellular immunity, what the T cells are doing. So the question will probably be, we're going to vaccinate everybody. And how long is the vaccine will be good for? Our puppy dogs have to get vaccinated for rabies every year. By the way, that vaccine is good for 2 years, but we know that people aren't real good about keeping up with dates. So in Alabama, you have to vaccinate your dog every year, hoping that you'll at least, have a large number of people who will get it done within the 2 years. But like tetanus, we have to take a tetanus injection 10 years. We have to take flu shots every year. So we really don't know how long we will have immunity either by exposure or by the vaccination process. There appear to be 2 strands of this virus. There is an Asian virus and there's a European virus. That's Bert's lay terms for it. I'm sure that our PhD virologist can tell us more detail. But we questioned one individual in Hong Kong that they think has had another infection, and they're studying that individual. And right now we say, do not test somebody. If you test positive, don't retest for 90 days. And that is based on the idea that you have antibodies and we don't want to waste the test. The reality that's come out with the CDC is that if you have symptoms of having a recurrent infection, we need to go ahead and retest you. And then they want to have special studies, and they're looking for serum to go up to the CDC to study, is this a different infection you had originally, or is this a reinfection?
Anyone else?
Yeah, let me ask just another question. I know we're coming into the flu season. How would we know, we physicians or patients know whether it's COVID or whether it's another type of viral flu?
Well, we don't know. I mean, we got influenza A, influenza B that we normally test for, really quick, simple, waiver tests that we can do. And we're probably going to have to start doing these, what we call point of care tests for COVID. So I think the standard we're talking about for pediatrics, and maybe doing something with South Alabama for pediatric patients, to go through as some kind of drive-through clinic for the kids. Is it influenza A, influenza B, is it strep, or is it COVID? And so we'll probably have some strange viral illnesses that are none of the above and just have to treat them symptomatically. But it's going to require testing. And the challenge is we don't want to bring a lot of people into the exposure of other people.
I think Dr. Sternberg may have had a question.
Yes, he was talking about his immunization, I think, for his dogs.
Yeah. Okay.
No, I did have a question.
Yes, sir.
This rapid test, the saliva test that they have, how accurate is this? And
You know, the question about accuracy is sensitivity and specificity are the two terms that we try to describe. The saliva test seems to be, if it's positive, to be pretty accurate. If it's negative and you have symptoms, then we have concerns and you need to go ahead and do the molecular test, the PCR test, because we think there are a larger percentage of false negatives that occur. So it's another tool, but what we really need is a data, Mel. So what we want is we'd like to know everybody gets tested, because the percent positives is important for us to know what's going on with disease transmission in the community. And the private doctors are reporting the positive cases, but we're not getting necessarily the number of negative cases.
how long is it taking for the PCR test to come back these days?
Well, it's gotten faster. We were up to as much as a week. And so your quarantine was about the length of time it took you to get the lab results back. But they're usually right now running about 24 hours and depends on the weekends. A lot of the laboratories are not running specimens on Sunday. Some laboratories are not running on Saturday. The Alabama Department of Public Health is collecting specimens on Saturday, but they're not running COVID-19 at this time. The total number of tests in the county for PCR tests for COVID-19 has been going down. And that's, we're not sure why, but we've got a lot of test capacity available, but we think it's decreasing community spread and fewer people are taking it more seriously and not getting exposed. The interesting number that came out, and this is the morbidity mortality weekly report for those who want to look at stuff. This is published by the CDC. It's published annually. And the interesting number that came out, this is the September 29th edition, but August 2nd through September 5th, the incidence of COVID-19 among persons 18 to 22 years of age, so 18 to 22 years of age, went up 55.1% nationally. So that's in about the same time about going back to school, playing football, and these other socialization processes that occur. The other one that's interesting is that we talk about is the younger people. The mortality rate is still in the older population. So 90% of the population, the death rate is occurring in people over the age of 60 years of age.
That's still pretty young.
I agree. It's getting younger every year.
Hey, Bert. Can
Yes.
you hear-
Yes.
Hey, Milton, Bert. If Pfizer is going to be the preferred serum, and people don't want to take it because they think it'll make them sick, what are the adverse reactions that are legitimate? Is there anything they should fear?
Yeah, that's a very good question, Milton. Pfizer, I mean, all the products are going to come to market because nobody can produce 250 million doses. So there are going to be multiple. What's going to be interesting, Milton, is that if you take the Pfizer product for the first shot, if everybody has to have two, and they're still under phase 3 of clinical trials, if you have to take 2 shots, you're going to have to take the second shot injection of the same product you took the first. So that's going to be a potential. Somebody said, oh, I got the Pfizer product. So we as healthcare providers are going to have to track that. There are probably going to be individual reactions like we talk about eggs and the flu vaccine that the pharmaceutical companies will identify in phase 3 of the clinical trials about absolute specific contraindications to taking the vaccine. I do not know what those are at this point in time, but I'm sure there are going to be some. And I think right now we have a lot of people who say, oh, don't take a shot because it's going to cause autism. I mean, it's the whole, what's really extended life expectancy in the world has been vaccinations. I mean, life expectancy went from 42 years to 72 years. And if you want to say, is it because of antibiotics? Is it because of medical technology? Or is it because of public health with immunizations and sanitations? The public health with sanitation and immunizations has had the greatest increase in life expectancy than any other medical factor.
At this,
If I may, Dr. Eichold, you talked about wearing masks. You've talked about the vaccine. Could you address some of the treatment that's been used for people once they have contracted COVID, and what kind of progress and success has been with those in that area?
Sure. The therapy, what we've learned a lot about is probably remdesivir, which is an antiviral drug. It's been out there, and it seems to be having a significant impact on people who are in the intensive care unit. You cannot simply go by. It's an intravenous medication. It's a 5-day course of therapy. So that is one that's a drug treatment that's having an impact. We've also learned that what we've done, used to think about putting people on ventilators, that was good. Ventilators are not really good. They're a necessity if you go into respiratory arrest, but by and large, using other form like high concentrations of nasal cannulas, using helmets and hoods and things of that sort seem to improving the outcome. The FDA is also approved using convalescent antibodies. So if somebody has had COVID-19 and recovered, and then they become a plasma donor, then they can give that plasma to an individual who's infected with it. That's a way that people are actually getting good antibody testing who think they may have been exposed, is go to a plasma donor center. They will screen you to determine if you have antibodies, and then you still get to make a decision whether you want to donate your plasma or sell your plasma. That's a personal decision. So that seems to be the most dependable, reliable source of antibody testing is in the plasma business, because they can sell it. So they will pay individuals for it who have convalescent plasma titers. The other one is just conservative therapy and supportive care. The better you are nutritionally, health-wise, weight-wise, fewer underlying chronic diseases you have, the better the outcome. So unfortunately, people sit down as we all know persons who have negatively been impacted by it. There was one individual as a CPA, went to a wedding. He was one of our earlier cases, death cases. He was in remission from cancer, and he was dead from the COVID-19 respiratory problems within a couple of weeks of being diagnosed, and died in Baldwin County. So it does shorten life expectancy. You'll hear people saying on television, only 7% of the people who have only COVID-19 die, or 3%. It's a very small number. But that number is correct. But usually what happens is that somebody has another either underlying disease. And in Alabama, 30% of the people are obese. So that is considered an underlying risk factor for COVID-19. But therapy is pulse oximeter. So if you have it, a little thing you put your finger in, it can tell what your oxygenation is. If your O2 blood saturation O2 goes below 92, and Mel, you can correct if you have other knowledge, but below 92 is where you need to be seeking health care and may have to be admitted to the hospital. Admitted to the hospital, the first thing is then you get supplemental oxygen if your PO2 is less than 92. And then they can give steroids, which is another form. The president recently had high-dose dexamethasone, which is big steroids. We actually have had patients who have improved with the nebulized inhaled steroids that some people use for asthma and that type of illness. There's a unique CT scan that looks like with COVID-19 in the lungs that's almost pathognomonic of having COVID-19. So, you know, good hydrations, good nutrition, oxygen therapy and support, steroids, antiviral, remdesivir, and then, you know, if necessary, going on to a ventilator.
Thank you.
Dr. Eichold, let me ask you this. This is a little bit off the topic of what you're saying, but do you have any take on this concerted effort, apparently in Alabama, by our former Chief Justice and others filing lawsuits in the federal court system and the state court system? I noticed last night that both of them have been dismissed, where they're trying to set aside the governor's masking orders. What's that all about? What's happening?
Well, it's interesting. You're the attorney, but it's a matter of what people say. You're infringing upon my personal rights to make my own decision. And so far, it's your personal right to do what you want to do, as long as it doesn't infringe upon the rights of others, has usually been upheld. And so they're saying is that I don't want to wear a mask. You can't make me wear a mask. But if you're not wearing a mask is putting other people at risk. I think that's why the law is being upheld at this point in time. So if you want to go not wear a mask and be completely by yourself, I don't think anybody's will sit down and say you got to wear a mask as you're driving your tractor on your 40-acre farm. but when you're in close proximity with other people, that they're upholding that is reasonable and constitutionally valid, you know, health requirement.
Thank you. Anybody else have any questions before we let the good doctor go?
May I ask, I've already asked a question, but I'd like to ask another one. One of the things is Michael mentioned, I'm currently president of the congregation, and we have a COVID committee, and we've been doing everything by Zoom, our services, programs like this and so forth. Do you, what is the your current view with regard to indoor gathering, whether it's in our congregation or restaurants or what have you?
Well, personally, you know, I have not gone to a sit-down restaurant since February. And I have not gone to any social gatherings, whether they've been funerals or weddings. And I think there are safe ways that you can gather people within indoors at the temple. The real issue is social distancing. And so if you're going to do it, we've encouraged at gatherings, don't have food and beverage. That seems to detract. So if you want to have people come to temple on Friday night, and everybody kind of figure out where they're 6 to 12 feet apart, that would probably be acceptable, but try to respect and wear a face covering. Don't shake hands, don't give people hugs, and don't serve food. But, you know, I've got somebody else who recently called me that they're having a wedding this weekend, and they've had somebody else now in the wedding party test positive for COVID-19. And how is that going to work out? It's a real challenge. And I think the more we distance, the better off we are. It's just very, very lonely. It's very hard on the elderly, especially in assisted living facilities, to not be able to see your family members. So I personally think that we need to reframe. Everybody said this is terrible. It's been going on, as I said, 205 days. I think back in our history, as we just don't have, and some of y'all are older than I am, a lot of depth of knowledge and experience and challenges. But I think about the mother who had a child or their husband was a soldier in World War One. But then they had to go through the 1918 Spanish flu, and then they had to go through the Great Depression, and then there was World War II. So we talk about doing this for 205 days and how terrible and horrible it's been, and how, you know, our lives have been changed. God bless the people who've gone before us during the previous pandemic, 2 world wars, and the Depression. We have some inconveniences, but the real big picture, we're doing pretty well.
Dr. Eichold, I guess on behalf of the Temple Board and all of us Temple members, I can't tell you again how much we appreciate your generosity with your time and your expertise, not only for tonight, but leading us through this pandemic. We are all very confident in your abilities, and you are a friend of the Temple. We want you to come see us at the Temple. And unless anybody else has anything else to say, I just want to give you my heartfelt thanks for your time tonight and for sharing the benefit of your wisdom.
Well, thank you very much, Michael, and thank y'all for carrying the flag.
Thank you.
It's very, very wonderful that y'all are, you know, continuing on, and this too will pass with time. There have been great challenges that we have overcome in the past, and this is one that we will prevail. It's just, you know, it's just inconvenient right now, and hopefully the vaccination process within the next year, realistically, I would tell you, priority-wise, vaccination is probably going to be the first. This hadn't been decided. Vaccinations will probably first go to the first people, like in the emergency room, the doctors and nurses who are there taking care of the patients who have known COVID-19. Second group that'll probably get it will be first responders, ambulance drivers, and people who are transporting the patients who are sick. The next group will probably be the elderly in long-term care facilities or people who are elderly with underlying medical conditions, and then will be more of a mass immunization process. The last people to get the vaccine will probably be the youngest members, youngest adults, because they seem to have the best outcomes even when they're infected.
Thanks a lot, Bert.
Thank you.
Thank you, Doctor.
Thank
Very
you,
much, very much.
and thank you again.
Thank you, Doc. Thank all of you. Bye-bye.